Well, I'm Dr. Oliver Glass. I'm a psychiatrist. I work specifically at Laurelwood, which is the inpatient side of Northeast Georgia Medical Center, specifically inpatient psychiatry.
I'm Dr. Parul Dev. I am one of the outpatient psychiatrists. I have been with NGPG for about 8 years now.
So I'm Dr. Miles. I am one of the consultation liaison psychiatrists on staff here, or CL psychiatrists. And my role within GME is to be the consultation liaison psychiatry supervisor for the residents.
My name is Dr. Kyle Armstrong, and I am a consult liaison psychiatrist. I work at our hospital system, seeing a lot of different kinds of patients, delirious patients, patients who need capacity evaluations, also our standard psychiatric stuff, so depression, anxiety. And with GME, I'm going to be helping residents with our emergency psychiatry. We work pretty closely with our emergency psychiatry or emergency department, so I get to handle some of that stuff and handle a lot of the acute things like agitation and restarting medicines and all the problems that are in our emergency room. So we're working on collaboration with them, and the residents are going to come help with that, so that's exciting.
I think with Northeast Georgia Health System, they have really been on the forefront with this pandemic and opening this door for telepsychiatry, so we're able to open the door to patients we really never have before. And we've been able to, and with the amount of patients that we need to see, it's going to be wonderful to have more doctors in this area and train more doctors. We also are able to see almost every diagnosis, which is awesome. You know, I see patients with so many different, and it's such a great place to learn. You see patients with anxiety, ADHD, and then totally different socioeconomic status.
So what I like about working in this outpatient practice is that I have seen almost every diagnosis, you know, from mood disorders to any kind of psychotic disorders, substance abuse, personality disorders. And so it's very stimulating and at the same time challenging. So really it's a place not only where you work but where you grow. So that's why I love it.
My subspecialty allows me to work not in the psychiatric hospital, but in the medical hospital, and I interface with other types of non-psychiatric specialties such as internal medicine, the emergency department, social workers, nursing staff. On the rare occasions, I even get to talk to the primary care doctors and people in the community. So I really love that liaison part of my consultation liaison role, and being able to be that go-between person between the mental health patients in this medical setting. And I think the culture here at our hospital system is one of appreciation for the mental health providers. So that's a big part of why I love working here.
You know, I was really drawn to NGMC because of the values that this institution, really supports. From the moment I actually came to interview, I fell in love with all the staff. You know, that really drew me here. I felt supported, and I really felt like I'm at home here. And so I think that when psychiatry residents come to work here and to train here, they're going to feel the same thing. It's a very special place.